So it's important to be able to recognise the many different and often subtle symptoms of lung cancer so that we can act quickly. Today I'm here with John Burke, Bupa's Medical Director. Let's start off by talking about some of the signs and symptoms that potentially could be lung cancer. We know that actually there might not be any at all, especially in early stages of the disease. But what are some of the things that people should be looking out for?
That's right, Zoe. I mean, the classical signs of lung cancer are things like a cough that doesn't go away after a number of weeks or some short period of time. Coughing up blood would be another sign to be very worried about. An ache or a pain even when coughing or breathing. And then unexplained tiredness or a form of breathlessness that isn't shifting, sort of persistent breathlessness. Sad to say as well, sometimes people suffer weight loss. And so that weight loss could be attributable to cancer of the lung.
I want to talk about persistent cough and persistent breathlessness. How long should people leave it before they get it checked out?
Well, the guidance for GPs in the UK is around 3 weeks. So if the cough hasn't gone away by then one could just book in to see the GP or contact the GP surgery, because that's what NICE guidance says, the National Institute for Care and Excellence. So yeah, it's always good to keep that in mind.
And those are some of the more common symptoms, but there are some lesser known symptoms that could indicate lung cancer as well. Can you tell us a bit about those?
People might not realise, but hoarseness of the voice, for example, can be related to the development of lung cancer. Swelling of the neck or the face, sometimes it can be quite subtle, could also be a sign. Finger clubbing, that means thickening of the fingertips is something to watch out for, although it's rare these days, I must say. And much more commonly is, recurrent chest infections, just something that can't be shifted.
And when we're talking about lung cancer in this way, we're talking about primary lung cancer. What's the difference between primary and secondary?
So primary lung cancer is one that originates in the lung, in the respiratory system. That's what people typically mean by lung cancer. Secondary spread from another form of cancer, let's say breast cancer, into the lungs. That's somewhat different. You could call that secondary lung cancer, or it's secondary spread.
So thinking about the primary lung cancer, which is our main focus, is there anything that people can do to reduce their risk and, potentially prevent themselves from getting lung cancer?
Prevention is the key. I mean, smoking is the greatest risk factor for developing lung cancer. And, it can be very difficult, as I'm sure you're aware, Zoe, to give up smoking. It can take several attempts, but any reduction in the amount of smoking, whether it's cigars or cigarettes or anything else, that is really fantastic to do. It's known that over time, that after 12 years of not smoking, a smoker can reduce their risk of cancer to half. By 15 years, they're down to the level of a non-smoker. So it's always worthwhile. Coming back to prevention again, good diet, high fiber, lower fat, and even exercise can help to prevent not just lung cancer, but other cancers.
I think that's so motivating for people to know that actually, even though you may have smoked for many, many years, if you quit now after 15 years, your lungs can actually recover and your cancer risk goes back down. I always say to patients as well, just to sort of set their expectations, there's lots of services to help them with smoking. You can access it through your pharmacist, through your GP, just to say that, you're not going to face somebody who's going to say you must stop smoking today, because for many people that's just too unrealistic. It might be that you plan to gradually reduce and quit in 6 months or quit in a year, but taking that first step to sort of almost planning how you might reduce or quit is really, really important, isn't it?
It is, and it's there for free as well. There's help available. So everybody's very incentivized in the healthcare system, professionals at the NHS itself, to try to help people to move away from tobacco products.
If you don't succeed the first time, it's okay. You can try again. Do you think that sometimes these symptoms can get confused with other conditions like asthma and hay fever and, COVID, chest infections? And how can people differentiate between these sort of common other illnesses and something that could be lung cancer?
Yeah, I mean, taking asthma that you mentioned as an example, cough is quite a sign for asthma as well, not just wheezing. And shortness of breath occurs in asthma as well. So it can be subtle. Again, I'd sort of make the mention of the GP surgery to help guide people with their regular asthma checks. And then when the need arises, that they would have, maybe the idea of mentioning a risk of lung cancer to their GP and the team around the GP so that those extra examinations can be performed.
Yeah, because people with these sort of long-term lung conditions should be under regular review, and I guess it's any change, isn't it? If there's been a real significant change and there's no obvious reason for that, then you should definitely let the GP know. Important question for you. Is it just smokers that get lung cancer? Can people who've never smoked, people who regularly exercise and take really good care of themselves get lung cancer as well?
So smoking is the highest risk for lung cancer, and that sort of cancer is known as most commonly squamous cell cancer, it's in a group of cancers known as non-small cell lung cancers. Non-smokers then tend to get adenocarcinoma, again in the same family of cancers, but unfortunately there are people out there who develop lung cancers who have never smoked, and it's somewhat, almost at random really. It's tied to genetics, it can be tied to environmental factors as well.
And also important to say that if you are experiencing these symptoms, doesn't necessarily mean that it is cancer. In fact, there are many other conditions that are more common than lung cancer that can cause breathlessness and cough. Can you tell us about some of those?
Yeah, breathlessness, as you mentioned, is reasonably common. So if somebody has a heart problem or if they've become somewhat unfit for whatever reason, then that breathlessness could be due to that. Asthma, as we've discussed as well, but what comes to my mind now is chronic obstructive pulmonary disease. So that's basically in two parts: emphysema, which is where there's damage to the air sacs in the lung, or chronic bronchitis, where there's inflammation of the airways deep down in the lungs.
So I guess the bottom line here is if somebody's worried, if they're having these symptoms, it's not for you to make the diagnosis. It's really important to go and see your GP. You can get some information from Bupa as well. But if they do go and see their GP, what can they expect to happen? What will the GP do? Will they be sent for any tests? And ultimately, how will they find out whether or not it is cancer?
You're right, Zoe. I mean, primary care is the first step to finding that sort of thing out. GPs are trained to distinguish between what's normal and what's abnormal. And in doing that, they'll take a history, find out what's the concern, perform a physical examination, and then weigh the risk factors that's presenting. So ultimately, a GP can decide to order a chest x-ray or even refer to a specialist or to a chest clinic, as it's called.
Great. Well, John, thank you so much for a really interesting discussion. I think it's so helpful for our viewers to understand a bit more about signs and symptoms that could potentially be lung cancer. And if you want more information on this topic, please do visit the Bupa website, bupa.co.uk.